Hello. Are we ready, Megan?
Yep, you're good.
All right. Hello and welcome to our third week of our regional report out calls. Today is December 29th, and this is our Kansas City Metro call. So if you can pass me the screen sharing option, I'll run through the dashboards. Let me give you just a couple pieces of information before we start. If you want to receive this video, along with the dashboard in your email after it's done, you can go to covid.ks.gov/report-outs. That's covid.ks.gov/report-outs. If you have questions or anything you want us to discuss on next week's call or any comments, go to ksregionalreport@gmail.com. And then if you want some free testing, last website I got for you is gogettested.com/Kansas. Be where you can find some free testing. Okay, let's go over our dashboard that's so generously put together by the Kansas Hospital Association. I'll put that up real quick. All right. And I wish you guys all a happy holiday, of course, as we're here in holiday week. And I appreciate everybody for participating on a holiday week. So here's the Kansas Metro Hospitality. This is as of Monday, December 28th. The three key statistics we look at, obviously some massive expectations, staffing shortages across the Metro. Here, 78% weighing in. And then we come and we see 24% of adult staffed ICU beds available. And again, plenty of ventilators. We're getting a little more information. The governor had asked about this number on deaths, and I think it's a trailing day, but we're getting feedback on that this week. So I'll have more on that next week. As far as the positive cases in the Johnson Leavenworth Wyandotte side of the Metro region, you can see still kind of a continued plateau going on in the area as far as the number of cases go. And then coming up here, just so you can see the percent of cases of the population and how the COVID how the ICU beds are related to COVID and non-COVID patients and what's open. So this gives us a snapshot of the KC Metro area. And I'll pass it over to our, sorry, my paper's all over the place, Steve Mayhew, to give us some color from a public health standpoint. Steve?
Great, thank you. So I'm Steve Mayhew. I'm the Preparedness Program Manager with the Johnson County Department of Health and Environment and am the Regional Preparedness Coordinator for the Kansas City Metro counties on the Kansas side. So few brief updates today. The numbers are still higher than we would like, obviously. In the past, we've talked about the impact of holidays on case counts and numbers and things like that. And so I just wanted to touch on, in the next couple of days, after Christmas and after New Year's, we kind of expect to see the numbers dip a little bit. And that's not because cases are down necessarily. It's more likely a reflection of labs not working on Christmas, not working on New Year's. And so when you're looking at your total numbers for the week, every week leading up to this, it's been a cumulative number of the 7 days. With the week of Christmas, week of New Year's, you're looking at 5-day weeks. And so if you see a dip, it's likely not because there's less COVID out there, but because less tests were run. And so I just wanted to put that out there. Another impact of holidays that we've seen, and we've talked about this with Thanksgiving and other holidays, is the impact of, 2-3 weeks after a holiday, you tend to see a surge in cases. And I imagine in a couple of weeks, we'll be talking about the surge from, last week and this week. And I mentioned that now to say that there are things that we can do today to impact that surge later on. And so, if you're looking ahead at and worrying about a surge in cases that you might expect to see, today matters. And so there are a lot of things, the actions that you take to protect yourself today can protect your community later on. And so, again, just an opportunity for people who have those concerns. The last thing I want to mention is sort of the impact on the public health workforce of the vaccine rollout. And so for the better part of 2020, we've talked about how health departments are really working on case investigations, contact tracing, testing, and it's really been the case that health departments have tried to squeeze every bit of resources and energy and time out of their staff and out of their departments to get as much testing and case investigations and contact tracing out into the community as possible. And we turn around now and we see the vaccines coming. And so just wanted to mention that, the public health workforce is going to be shifting a little bit. We want to try to maintain the level of testing and investigations that we have, but we also know that when we get vaccine, we want to get it out into the community as quickly as possible. And so I mentioned that only to say that, I am proud of the work that public health has been doing and proud to work alongside people who have put so much into it. And so that'll continue, but wanted to put some recognition there because there's a lot of people who have put everything they have into this. And so, and that's pretty much my update for today.
Great point, Steve. And I'm looking at KDHE's site, and I guess since I can still share my screen, I'll let everybody see it here. So when you get into their COVID stats, under hospital capacity down at the bottom, they have a weekly percent positivity by the regions. And so what you can see here for Kansas City, and are you guys seeing my little finger? So you can see here in the Kansas City region, there was right around 30,000 tests a week. And this last week it was 20,000. So just to support your point, you can see 9% positivity rate, 9.74 over 10, and that's what those colors mean. So far this week, and it's only 500 tests, but the Kansas City region is at a 15.3% positivity rate. So I thought just to support what you were saying there, I'd do that. Now let's pass it over to Kenny Wilk. Kenny, can you introduce yourself to everybody?
Sure. I'm Kenny Wilk and Vice President for the University of Kansas Health System. And we have Bryant, so I'm going to go ahead and toss it to Bryant, and he'll speak a little bit about the metropolitan area, the Kansas City metropolitan area. Then I'll add a comment or two from the University of Kansas Health System perspective. So Bryant.
Thank you, Kenny. Remember to unmute this time. So appreciate the opportunity to be here on this holiday week. As you can imagine, and as already highlighted a little bit, the reporting and all of that is down just due to the natural cadence and flow of the holidays and different staff being in and the requirements and the like. Really, the overarching concerns remain the same, which, let's be brutally honest, it's been the same concern since the beginning of all of this, which is, hey, take the responsibility to do the right things, maintain social distancing, hand hygiene, masking, and all of those things. And even now with the vaccine, beginning to be rolled out to some degree, whether that be to the healthcare workforce, those in long-term care settings and the like, that is still doesn't allow you to let the guard down. And in particular, those that have been vaccinated still need to follow those same requirements, as the research and data shows. The studies weren't designed to see if you shed virus. They were designed to see if you were protected from having symptoms with the vaccine. And so all of those precautions are still really necessary. And I think, the hospital community is just really trying to get people to embrace and take those to heart, small group gatherings, if you're going to have any gatherings, maintain distance, masking, et cetera. As far as capacity, I think, as John shared on the dashboards there, capacity is really staying fairly static over the last number of weeks in terms of, the majority of hospitals are experiencing critical staffing issues just due to their overall volumes combined with the extra workforce that's out for quarantine or isolation, as the case may be. But the ICUs are still in a manageable spot. And I think that's really the key, is that there's some pressure points in here, but things are still manageable, and we're not quite as close to that tipping point as we were a couple of weeks ago, but it's still not very far uphill before we start to see that. And I think, Kenny could probably speak to that a little bit more directly from the University of Kansas Health System's perspective. So Kenny, I'll give it back to you.
Well, thank you, Bryant. And I would echo the comments of Bryant and Steve and John. We probably have a few shorter comments. today just because it is the holiday, but our numbers are actually down. Our inpatient counts are down. We were hoping that would happen. We kind of topped out at around 170 or so.
When you're saying our, that's the KU health system. That's the
yeah, I'm talking about just our hospital, just in Kansas City. So we had about 170 was our top end number. That number is down to around 125 this morning. So we're thankful for that. That gives us a bit of a respite, but we also know that that does not show any. It'll be several days before we know how Christmas is going to impact us. So there was an impact from Thanksgiving, and as Bryant said, it was manageable. Fortunately, because we're like everyone else, our staff is tired. They're wanting some time off as well. We're trying to manage that. We have a lot of other demand, and John, I know you've heard us say this before. We spend most of our time on these calls talking about the situation with COVID, but I really feel compelled to make sure we understand that from a hospital standpoint, there is a high demand for non-COVID care. There's lots of other care that's needed to be delivered out there. I noticed on the Kansas numbers that you shared, if you add the metropolitan area along with Kansas, I think we're around 13 or 1400 inpatient count. That number had actually topped 2,000. So that number is down as well. But what's really important for people to understand is most hospitals, if they didn't have any COVID patients, would still be running nearly full. So that means there's other people out there that really have care needs that are not getting in. So we're going to be suited up and ready to round into the new year. I like what Steve said about the comment, what you do today, what we all do individually today matters. We in healthcare understand how frustrating it is. We know how painful it is to not to be able to spend time with your families. The good news, John, is we are making progress on the vaccinations, not as rapidly as we like, but we are making progress. They are getting distributed. We at the University of Kansas Health System are getting close to having all of our direct frontline people that are exposed on a daily basis to COVID, those that want it vaccinated. That's a real positive. That is a real positive. Our staff's excited about that. We're excited about that. It is the first round. They got another set of shots coming, but it certainly offers us all a lot of hope. We're hoping as we round into the new year, we can all stick with this and keep doing what we've been doing, practice those pillars of infection prevention. That's really what we need on the hospital side. We want to be there to take care of the sickest of the sick when they need us. And we're going to do all we can to continue to offer that support as we go into 2021. And certainly we're all looking with an eye towards the summer, hoping that things are much better by then. So thank you, John.
Thank you, Kenny. Now, to kind of round out this conversation, we've asked Dr. Watson back on. You remember him from last week with Cheyenne Mountain Software, who has the mission control software that's helping with transfers. And his team has put together some additional information regionally and to provide more color around the transfer situations. Dr. Watson, go ahead.
Yeah, hi, Richard Watson, Kansas physician, one of the founders of Cheyenne Mountain. And our software helps tie hospitals that are sending patients to hospitals that are receiving patients, and then also ties the transporters, the EMS groups, both air and ground together. And we look at a little different picture than some of the other reporting numbers. We look at how people are moving through the state and what's the complexity of moving a patient from one place, rural Kansas to urban Kansas. And so because of that, we have a little bit different vantage point, and I'll show you the dashboard that we monitor from time to time, updated every 2 hours. And this is globally looking at a state view. And I think as we've broken it down by region, really there's a lot of homogeneity in the regions at this point compared to some of the other time periods. I've got it set on, I think, 20 days here. And what we're seeing is a lot of stability in the movement of patients. As we look at the numbers of COVID patients, the percent positive, maybe a little easing of that. We were up at 38% at one time. We're down around 30% now of the patients that are moving in the state are COVID suspected. We're seeing that still about 40% of the facilities are asking us to assist with bed finding activities. I think it's been said on this call that while there is some easing of capacity issues, we're still seeing that capacity is a problem across the state, depending specifically on what types of patients are moving. I do like this number that we were up as high as almost 2 hours previously, the time it takes for a patient to actually have contact with EMS groups that are moving them. If you're waiting a long time to get a bed placement, this can be up. And like I said, we were, I think, an hour 56 previously. This is a much better number. It does, if you do say, what's the COVID piece of that, we can see that there is a huge difference in that compared to all comers, which I think is indicative of just there are pockets that are difficult to find placement for even now. The other thing I want to say is that this tends to ease just a little bit, that we are seeing the acuity actually be less than it has been before, but only slightly, as well as then the number of patients moving almost exactly the same across the board, and the breakdowns of what those patients look like from region to region is about the same. So I think there's some good news in the fact that we're not seeing the same acceleration that we were seeing before, that the stability is real and that it seems to be continuing. I think the acuity level may be easing just slightly, and the ability to find beds are easing slightly. But I do think we still have particularly pockets that are difficult. And I noticed over the holidays, especially as we monitored the transports, we had a couple days over the Christmas weekend that were just brutal. And there was, you're dealing with staffing issues related to the holidays, as well as just capacity issues in general. And there were definitely choke points at those time frames where we had trouble moving patients. But overall encouraged, and just think we were 3 weeks out from Thanksgiving before we really saw what the effects of Thanksgiving would be. The reports were 90 million Americans traveled over the Christmas holidays. That's quite a bit of the population. That's surprising to me. The airports were full. It was a different scenario even than Thanksgiving, and just cautious here about what this might look like over the New Year's and going into January first week and second week.
And Dr. Watson, are you able to look at kind of the Kansas City Metro specifically at all, or how those?
Not on this breakout, no. And I think the thing on Kansas City Metro that's unique is those are almost all receiving hospitals. And so what we will see is that a lot of these receivers, and I'll show you another look here if I can do this appropriately. And maybe I'll be able to, maybe I won't. No, I don't think I can here, what I was going to do. But our bed capacity issues, I was going to show you what that tier 1 looked like. And the tier 1s, honestly, we're at either critical capacity or no capacity as outlined in the Kansas City Metro region. And I think it does speak to two things. Number one, there are fewer patients there, yes, but the staffing is the issue related to trying to give people time off, I think, as Kenny was saying, and also just realizing that that you can only staff at a high level for so long before you have to give people a break of some kind. There's no way to continue to push the river there. So.
And I may ask, Kenny and Brian, I'll ask you, we get questions about elective surgeries. when you think about the large hospitals in the Kansas City metro, have they had to make any modifications to the elective surgeries, or what's going on there and how that works? Can you explain that?
Yeah, so I'm happy to jump in, and Bryant, you can, if you got something to add. So the short answer is yes, John, we have. We've gone through department by department and asked each of our groups to identify those procedures which could most easily be delayed. Really important to understand, we've stopped using the term elective procedures. It's elective when you're talking about somebody else's procedure, but if it's one that you need for your purposes, the individual patient typically does not find that to be an elective procedure. They find it to be, a delayed procedure. And we know from March and April, there was some real damage done from that. So we've tried to be very selective, but yes, we have rescheduled. And we needed to do that, kind of early there in December. We pulled the trigger on that and have been doing that now for several weeks. And I think, Brian, you correct me if I'm wrong, but I believe most of the hospitals in the metropolitan area are doing that to some extent. We're all trying to limit that, but it has happened.
Yeah. So this is Bryant. I'd just add that much like Kenny said, it really has turned into a discussion around deferrable and non-deferrable procedures, and how long any certain procedure can be deferred. And you are seeing it pretty much widespread. Obviously, each hospital and system has its own approach and way that they go about it due to their own unique staffing and supplies and space and all of those constraints. But much like Kenny said, the real issue is we learned a lot back in March, which is you cannot just indefinitely put all of this more or less routine medical care that churns through the system on the back burner. You end up with patients that if they would have been treated earlier wouldn't need quite the aggressive treatment that they need today. And so it really is almost an individual case-by-case basis on the deferrability, and you see that being managed by each hospital as they look at it. We have seen some innovative things that some of the Kansas City area hospitals have done, looked at moving their surgery schedules around throughout the week, doing more later in the week when typically that is not routine practice, so that there's a more even flow. We don't have spikes of patients in at any one given time on these deferrable type procedures and the like. So there's a lot of operational things that are going on behind the scenes to keep it functioning as high as it can. I think you kind of take an analogy of running at near capacity all the time. You got to keep everything well lubricated, well oiled, so that the friction doesn't build up. You don't get the piece of equipment to bind. And I think that's really what you're seeing the hospitals do. They're using any of the tools at their disposal to keep the flow lubricated, so to speak, so that patients can keep moving through.
Brian? Well, anybody, before I wrap up today, anything anybody wants to add to the conversation, Steve or Bryant, Dr. Watson, Kenny?
I just want to thank everybody again for everything they're doing.
Absolutely. Let me throw out just a couple things that have been asked by some of our partners to mention. One of them is as the vaccine starts to roll out, there is scams around vaccines. Unfortunately, you hear about fraud and that. So just, for listeners or people that know folks, 3 things to remember. You will not be asked for money to enhance your ranking for vaccine eligibility. All right. You will never be asked for money to enhance your ranking for vaccine eligibility. The second thing is government and state officials will not call you. They will not call you to obtain personal information in order to receive the vaccine. And the third is you will not be solicited door to door to receive the vaccine. So 3 things to keep in mind. I know some of it may sound silly or obvious, but people scam because it works. And so just keep those 3 things in mind. The other thing to just be aware of is over the past several months in the middle of the pandemic, there's been a lot of unemployment fraud as well. We're hearing that from our friends at the Kansas Chamber, and I've seen it in our company as well. And so just something to keep an eye out for, and to make sure that you're working with the State Department of Labor on that to help keep that clear. But just a couple of scams that are out there. Now let's end on a bright spot and not on those two dark spots. Bright spots here, every call, just catching people doing something right. Douglas Elementary in Kansas City is putting together care packages to send home in the school pickup lane, complete with masks, sanitizer, and information about testing and other public health matters. This comes out of the Kansas Leadership Center, doing 1,000 meetings locally, help people think about things they can do. And this is what Douglas Elementary in Kansas City decided to do. A great step. Take together and lean into the pandemic. I just want to wish everybody happy holidays. Thank you, one, for making the time to be here, two, for being on the front lines for Kansas, and we'll just continue to monitor the numbers. And I just invite all of you back here 1 o'clock every Tuesday to hear what's going on in the Kansas City metro region. You can sign up for an email at here it is, covid.ks.gov/report-outs, covid.ks.gov/report-outs. And if you have questions or comments, ksregionalreport@gmail.com. Thank you all very much for being here. Kenny, Bryant, Steve, Dr. Watson, appreciate your time. Have a happy